Thank you for choosing the Crystal Clinic Orthopedic Center for your upcoming spine surgery.
As a hospital dedicated to orthopedic care, our goal is to help you recover more quickly and get you back to the activities you enjoy sooner.
This education video will help you understand what to expect before, during, and after your surgery.
We believe that the more you learn about what to expect, the better you will do.
We're very glad that you chose us to do your surgery, and we're going to take great care of you. My name's Julie. I'm the patient care coordinator. Myself, a nurse, and a therapist are going to talk to you a little bit today about what your surgical experience is going to be. The first thing we want to talk about is what to do to prepare your home for when you go home. You want to make sure that you move any throw rugs and any extension cords so there's nothing that you can trip over when you come home. Make sure that anything you're going to need is on the counter level because you will have some bending and lifting restrictions. You cannot bend, push, pull, or lift more than 5 pounds. Think of a gallon of milk, that's about 7 pounds. So if you have cups in a high cupboard, bring them down to the counter. If you have pans in a low cupboard, bring them up to the counter. That way you don't have to reach or squat to get the items you need. You also want to check the pets. Pets are going to be really excited to see you when you come home. So make sure you put them in the bathroom when you first come into the house so you can sit down and be prepared when they come out and they don't jump on you and knock you off balance. The night before surgery, there's a couple things you can do to help prevent infections. You want to take a shower the last thing before you go to bed that night. Use an antibacterial soap or whatever soap your surgeon recommends. Make sure that you wash with a clean washcloth, paying special attention to the surgical site. When you get out of the shower, make sure that you dry with a clean towel. You want to then put on clean pajamas, and you can even change the sheets in your bed so that they are clean too. In the hospital the day of surgery, you will be given an antibiotic to also help prevent infection. When you come into the hospital the day of surgery, you're going to start at the registration desk. They're going to take your personal information and ask you about your medical history. Then you'll be going to our same-day surgery area where you'll be prepared for your surgery.
What about obstructive sleep apnea? Have you ever been diagnosed with obstructive sleep apnea?
Yes.
Okay. And do you use a CPAP or a BiPAP?
Your family's going to go to the waiting room where they'll be given a pager so that after the surgeon is done, he can page your family and let them know how you did. On the day of surgery, there's a few things that we'd like you to bring with you. The first one is a medication list. We want to make sure that after your surgery, we get you back on your regular medications. We ask that you not bring the medications themselves, but just bring us a list. We'd also like it if you'd bring a copy of your living will or your durable power of attorney. You're welcome to bring your own clothes, but we will provide hospital gowns for you so that you don't risk getting your gown soiled. We ask that you not bring any valuables. If you have a wedding ring you don't take off, we'll be glad to tape that for the surgery, but please don't bring other jewelry or cash. Your journey's going to start out in same-day surgery. You're going to change your clothes for surgery. They're going to put the clothes under your cart and they will follow you through your whole journey, so when you get to the 7th floor you'll have your clothes as well. They're going to start your IV. They're going to ask your medical history. They can give you medication for pain if you're in a little bit of pain, so let them know that. In same-day surgery, if you haven't had pre-op labs, an EKG, and an x-ray done, those things will be done that day. You also may meet the physical therapist before your surgery to be measured for a brace. If that happens, or if you got your brace before you came in for surgery, please make sure that you bring your brace with you for surgery because we're going to need it on the 7th floor after you get up there following your surgery. You'll go off to surgery. The length of your surgery is variable. It depends on what the surgeon is doing. So whatever the surgeon estimated as your length of surgery, kind of go with that time frame. After surgery, you're going to go to recovery. You'll be in recovery for at least an hour and sometimes longer. You're going to be hooked up to a heart monitor where they can monitor your rhythms. They're also going to check your other vital signs, your blood pressure, your pulse, your temperature, and your oxygen level. We're going to be monitoring your pain in recovery as well. Pain is measured on a 1 to 10 scale. 1 is no pain and 10 is the worst pain you can imagine. We're looking for changes, so if we come in and we ask you how your pain is, you tell us an 8, we're going to medicate you for that pain. We're going to check back with you in a little while, and if your pain is in the 5 range, we're going the right direction. We have multiple options for pain, so we can change medications, we can change your position, we can add some ice. Let the nurse know if you're having pain so that she can make some changes and she can help you with that. Our goal is to get you as comfortable as possible. Once you are doing well and waking up easily, we're going to move you up to the 7th floor, which is the spine post-op unit.
Once you leave recovery, you'll be coming to the 7th floor spine unit where you will meet your nurse. She will take your vital signs, do a neurologic assessment, and listen to your heart, lungs, and stomach. She will also orient you to your room. Your nurse will also assess your pain level and inform you of the pain medication that your doctor has ordered, as well as the next time you are due for it. Remember, your pain medication is ordered as needed. If you need to get a hold of your nurse or need any assistance at all, please use your call button located at your bedside. It is the big red button located at the top of the device. Your bed controls are located on either side of your bed. The top buttons move your head up and down, and the bottom buttons move your feet up and down. You will have an IV after surgery to keep you hydrated. This may be discontinued once you're able to tolerate liquids. To prevent blood clots after surgery, you'll have pneumatic cuffs around each calf. The pneumatic cuffs are hooked up to a pump that pump up with air to help promote circulation. Your nurses will be keeping a close eye on your oxygenation after surgery. You may need supplemental oxygen, but your nurse will determine when this can be discontinued. Your incision will be covered with a gauze dressing with tape. Your nurses will assess it daily to make sure it's not saturated. In order to prevent pneumonia after surgery, your physician has ordered that you use an incentive spirometer along with coughing and deep breathing 10 times every hour. Depending on your surgeon and your specific surgery, you may have a drain tube coming from your incision. What this does is slowly suctions out any extra fluid, including blood, from your incision site. Also, depending on your surgeon and your type of surgery, you may have a catheter inserted into your bladder that will drain your urine. Our goal is to get this out as soon as possible. Your first night of surgery, your physician will require that you at least get up to the bedside, if not sit up in a chair or go for a short walk depending on how you're feeling. Just remember to call the nursing staff to come help you. Your physician has ordered that you start out with a clear liquid diet. This will be delivered shortly after you arrive to the 7th floor. The clear liquid tray will consist of soup broth, jello, lemon ice, and hot tea. If you're able to tolerate the clear liquids, you may be advanced to solid food and order off the menu that's provided to you. However, if you are feeling nauseated, you should continue with the clear liquids. For your safety, your nurse will be checking on you periodically throughout the night, checking your vital signs, and if any lab work is ordered, it will be drawn very early in the morning. The physicians will be rounding on you very early in the morning, assessing how your night went, any pain issues. The morning after surgery, a physical therapist will be in to see you and work with you in your room.
Physical therapy will start the next morning after your surgery, and things that we're going to be working with you on is teaching you how to get in and out of bed, how to transfer out of bed into a chair, out of the chair, bedside commode. We're going to teach you how to walk. We'll teach you how to do any steps you have to encounter at home, review exercises if you haven't been taught those, and how to get in and out of the car. The exercises that you'll be doing are ankle pumps, some ankle circles, some quad sets or just tightening your knee, butt squeezes, some heel slides that you'll be doing all those in the bed, and then you'll do a few general flexibility exercises sitting on the edge of the bed. The exercises will help with some general circulation and some flexibility. Corset, it helps to stabilize your stomach muscles or support them, which in turn will keep your back straight. You're going to want to wear that corset when you're up out of bed for the day, even if you're just sitting up in the chair. You do not have to wear the corset to bed, or if you have to get up to go to the bathroom at night, you don't have to put the corset on for that either. In order to go home independently or with assistance, you need to be able to get yourself in and out of bed, stand up safely, walk about 50 feet, and do the steps. If you're having trouble with the activities, a social worker will come in and speak to you about choosing a facility to continue more therapy before going home. but most people do go home after these spine surgeries. Now that you're home, we would like for you to continue with your exercises that you've been taught by your therapist, such as your bed exercises consisting of your ankle pumps, your ankle circles, your quad sets, your glute sets, your hamstring sets, your heel slides. Also, keep going on with your 2 exercises you do sitting up, your hamstring stretches, and your abdominal strengthening. At this time, we would like to remind you to continue with your walking program that you will be working up to 2 30-minute walks a day.
We hope that you found the spine educational video to be informative and it answered some of your questions.
And of course, if you have any questions, please feel free to ask. Write them down or bring them with you to your next appointment.
We are happy to answer all of your questions to ensure a successful surgery and a quick and healthy recovery.
Thank you for choosing Crystal Clinic Orthopedic Center.